Okay. Hi, everyone. My name is Jaden Petrus. I am a project assistant for the Howard University Pediatrics Department, and I'll be announcing the winner for our raffle number 2. So the winner for today's raffle is Brittany Doxel. So if we have Brittany Doxel here, you will be receiving a $50 Visa gift card, and congratulations. So I'll announce your name again, Brittany Doxel. Brittany Doxel, and we'll be reaching out to you via email to coordinate sending you the card. So thank you for participating in the raffle, and I'll be turning this over to Mr. Derek Robinson, who will moderate the next session. Thank you.
Good afternoon, everyone. My name is Derek Robinson. I'm a member of the Positive Entre Empowerment Group. And I've asked Mr. Larry Bryant to share our screen. Heterosexual men living with HIV standing together against fear, blame, and shame. Next slide. Our presentation today will be facts and myths of HIV stigma among heterosexual men. This is a multicultural perspective on HIV stigma that is prevalent among heterosexual men, internal and external, with different modes of contracting HIV. Our subject matter expert will speak and answer questions on different topics and the need for inclusion in HIV stigma messages, research, medical support services, and for those aging with HIV. Next slide. What is HIV stigma? HIV stigma is negative attitudes and belief about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be social unacceptable. Learn more at cdc.gov/together. Next slide. Key findings from the 2021 State of HIV Stigma. Knowledge concerning HIV. There was a 3% decrease between 2020 and 2021 with people feeling they had knowledge about HIV. Discomfort around people living with HIV. 53% of the medical professions have discomfort around people living with HIV. 44% are barber and hairstylists, and 35% of teachers. Regional differences. The South and the Midwest had the highest rate of stigma with people in the medical profession with HIV. Next slide. What are some of the ways and strategies to combat stigma? 1, I will highlight some of the key points. Community engagement and cultural sensitive information that is accessible to different age groups to counter misinformation. People feel what they don't know. 2, build trust and self-advocacy through peer navigation between healthcare providers and patients. Next slide. 3, confront fear with facts and honest conversation. 4, consider internal and external factors of labeling that heterosexual men face as being bisexual or on the down low, which may be a barrier to them accessing the healthcare and support services that are needed. Next slide. New diagnosis in the United States independent areas for most affected subpopulation. And as you can see on this graph slide, that white men are not included in these graphics that are heterosexual. Next slide. New HIV diagnosis among men in the United States in dependent areas by transmission. And as you can see, 9% of the contact is through heterosexual. Next slide. heterosexual men, and HIV. Heterosexual men are seldom mentioned in HIV prevention research, policy, and intervention. Factors such as poverty, unemployment, and incarceration may disproportionately affect heterosexual men. These factors have shown to lead to increased HIV risk and underscore the need to prioritize prevention and treatment initiatives for heterosexual men. Next slide. Today's panel will consist of 7 heterosexual men that are living with HIV, 1 including myself, Derek Robinson. Next. Alberto Perez Bermudez. Next. Larry Bryant. Derek Canis. Sean Mark. Kevin Marshall. And we will also be hearing from Mr. Clayton Siam. Next, we'll have a short presentation by each of our panelists, 2 to 3 minutes, and we'll open it up for questions and answers. And we're asking everybody to put their questions in the chat box. And Mr. Kevin Marshall will begin. Okay, he hadn't been able to get on now. So would you begin, Sean?
Sure, thank you, Derek. And I just want to take a moment and also say thank you for everyone joining us here today at the 12th International Conference on Stigma. As Derek already told y'all, my name is Sean Mark. And I was born positive in 1989 with HIV. I've lived the past 32 years with HIV, and it's given me a very unique perspective. Just a quick rundown on what I've gone through. Because of my HIV status, I've been accused, I've been threatened, I've been sexually harassed, I've been teased, I've been bullied. I have been subjected to experiments and drug trials. I've had my sexual preferences diminished, all just because I have HIV. Nobody ever tried to look further into me, who I was as a person, and they kind of just stopped at the surface. I feel like a lot of the fellow members of the panel today are going to be able to share more of their stories, and maybe you'll find a way to relate to our stories as well, and that we're just trying to spread awareness that HIV isn't, heterosexuals aren't immune to HIV, and that HIV affects us all. And with that, I'd like to turn the rest of my time back to Derek. Thank you.
Okay, next will be Mr. Clayton.
Good afternoon, everyone. My name is Clayton. I was diagnosed in 1998 when I was admitted to the hospital for an unrelated medical condition. Unbeknownst to me at the time, one of the tests they did was an HIV test. When they brought the news to me, I was caught completely off guard and was left totally in shock. The last thing they said to me was go home and spend as much time as you can with your wife or your children. You probably got about 3 years. I tried to find support and some love and compassion. I reached out to my mother, whose initial reaction was, you brought this on yourself. I reached out to our circle of friends, And I was met with people getting up from our dining room table in the middle of a meal and leaving the house. I had people quit calling us back, returning our calls. I've had people ignore me in public in the town where we lived. The worst thing of all was probably when my kids came home from school crying, telling me that their best friend's parents wouldn't let them play with them anymore, and they wanted to know why. I've had doctors refuse to treat me. I've had a dentist stop mid procedure when he learned of my status and refused to go any further. Um, I'm sure it's things we've all experienced. Today, I'm working as a peer navigator and a public speaker on HIV. Um, and the one thing I can say as a heterosexual man living with HIV is that today, when I disclose my status, I'm still forced to defend my sexuality. Assumptions are made. I must be gay. I must be an IV drug user. This happens still to this date, and it's very frustrating, to be honest with you. The stigma today in 2021 is as bad as it's ever been. Thank you.
Thank you. And now, next speaker will be Alberto Perez. He may be having some technical difficulties. Derek Canes.
Thanks, Derek. So to start my story, we need to jump all the way back to 1985. I was 3 months old and my family is being told I have a very urgent heart condition that needed open heart surgery. And in order to survive the surgery and the recovery, I would need blood transfusions. And this was urgent, so there was no time for family to donate blood. It was going to come from a blood bank. And it did. And I made it through a very rough surgery, 3 months in a hospital during recovery. And all through for the next 16 years, as I progressed, it was being noticed. I wasn't as tall as the other kids. I wasn't as fast as the other kids. And my doctors are telling me, well, you have a bad heart. Heart problems always gonna make you smaller. And it took 16 years and an entirely new medical team to educate me on the fact that my heart had nothing to do with my size. And it was by just sheer luck that a medical student went all the way through my medical records and saw that I had had blood in 85 and I had never had an HIV test. So I went 16 years undiagnosed all the way to an AIDS diagnosis. And the virus has destroyed me physically. I look like the pictures from the 90s. My face is thinned out. My stature is small. I look very, very frail, which is why I started the End the Stigma campaign to show that I am still strong, I am capable, and to stand up for everybody that's been stigmatized, that has to deal with the looks and the little rumblings that happen when they enter a room. And I'm just here to show that you can do anything after this diagnosis. It is not a stopping point. It does not define you. And I'm here for anybody that needs support. You can find me at my website, which we'll put in the chat. And I just want to say thank you all for letting me be a part of this.
Okay. Is Mr. Cabin Marshall? I don't see his name as one of the attendees. I don't know whether he's having technical difficulties at this time. Now I'll introduce myself again. My name is Derek Robinson. I am a member of the Positive Entre Empowerment Group. I advocate for returning citizens, those who have been formerly incarcerated in Northwest Florida. There's a stigma associated with people that are HIV positive that have been incarcerated. All men do not receive that diagnosis because of behavior that happened while they were in prison. Some people find out because of mandatory testing while they're in prison. Some people were positive before they went to prison, and some people become positive because of the behavior while they were in prison. But also, this could become as a result of a rape while a person is being incarcerated. But all may face the same type of stigma because they have been incarcerated. So I advocate for people so they will be able to return into society and live a healthy life as a returning citizen. Speak with prison reentry groups through shared experience and as a subject matter expert. For a long time in our community, people that has been incarcerated has been blamed for the HIV epidemic in certain communities. The language that is used is very demeaning. And I'm just gonna have to speak truth to it. You know, most people say, you know, that she or he or they, you know, they have that shit. You know, that's the way people feel in the neighborhood. You know, that's the new language when it comes to HIV. And when somebody speak in that manner, to me, it's more degrading than saying a person has HIV, because they have to overcome that derogatory word, you know. But basically, you know, the person has a physical condition. You know, the person has a medical condition that they are addressing, but still the stigma is tagged upon them, you know, for being HIV positive. So what I try to do through reentry and through talking with people in the community in Northwest Florida, I live in the rural areas, so there's a lot of issues that we face that people that's in the inner city might not face. But I want each and every person that is positive, whether a male, a female, whether they're transgender, to feel comfortable going into a community-based organization, an AIDS service organization, going to the health clinic, going to see their primary doctor, going to see their infectious disease doctor. I want them to feel comfortable. I don't want anybody to have a barrier to accessing the services that they need or support services. Thank you. And our last person that will speak will be Larry Bryant.
Good afternoon, everyone. My name is Larry Bryant. Here to share my story. So happy to be a part of this panel. So happy to be a part of this conference, 12th Annual International Conference on Stigma. I have seen a lot of growth since I was first diagnosed in 1986. The advancement of medications, the advancement of a variety of interventions, but we still have a long way to go. When I was diagnosed, I was 18 years old, freshman football player at a HBCU in Norfolk, Virginia. Found out not because I had symptoms, not because I felt sick, but because I just went to the Red Cross with with teammates and friends to donate blood. And the idea of donating blood to Red Cross, I'm not sure if it still happens now, but certainly in the 80s, they would give you money, $10, $20 if you came back. And as a broke college student, I took advantage of that when I could, until I couldn't anymore. The doctor shared that when I went back the second time, that I couldn't donate anymore. He wouldn't tell me why. He's not in front of my friends. He pulled me, or he asked me to come to his office. At the time, I wasn't completely aware of what was happening. but he just completely stood back. He wouldn't come anywhere near me. Long story short, he basically told me I couldn't come back there to donate blood because I had tested positive for the antibody that causes AIDS. And I mean, the term HIV positive haven't even at that point didn't exist yet. So the idea, and even though we've seen certainly during that time, the devastation that the epidemic had been caused, Melvin Lindsay, big radio DJ and was on BET from DC, hosted Video Soul. We literally saw him die almost literally on air. He took some time off of BET hosting a show. A few months later, he was on the cover of the Metro section, the Washington Post, lost about 100 pounds, and a few weeks after that, he had passed. And that's kind of when it became real. This was before I was diagnosed, but so many people at the time were dying and not receiving help, not receiving education to protect themselves. So when we went off to college, it wasn't the idea of protecting oneself from HIV wasn't properly articulated to any of us. And I always say we were never, ever properly introduced to this pandemic, certainly not in this country. When we were first introduced, we were told it affected gay white men in urban areas like New York and San Francisco. It affected Haitian immigrants. Then it was injection drug users. But we were wrong. It affects anyone who has unprotected sex, whether you're gay, straight, your sexuality, your gender, it doesn't matter. Now, obviously, over time, we have learned a whole lot of what pushes the epidemic, which communities and which populations are ripe for, high risk communities. But we also know that we have solutions. I mean, again, a lot of things have happened between then and now. One of those things is the campaign to end AIDS. It was a coalition of people living with HIV and AIDS, their advocates, their loved ones, demanding that their leaders, both on the local level, on the federal level, on the national level, exert the political will and policies that would stop an epidemic that was both treatable and preventable. We need more of those solutions today. We're not out of this. We're not out of the risk management and the risk that is applied to people who live in poverty, who don't have access to healthcare, who don't have access to the education and support to lead positive, to see positive health outcomes. But this is not just true with HIV. There's so many things. New Orleans in 2005, Hurricane Katrina happened. It essentially blew the city away, flooded the entire southeastern portion of Louisiana and killed thousands of people. But what was exposed in the aftermath was not that what the hurricane did to the city. It was the preparation and the lack of response from the city. We are seeing the same thing with HIV in that we do not have political leaders, we do not have community leaders who are able to implement those policies in the way that is necessary to save lives, to prevent new infections. And the bottom line is we have to do that in a much broader, much more purposeful way, because we're looking at an epidemic that even if we found the vaccine today, this afternoon, to give it to anyone living with HIV, stop new HIV infections tomorrow. With all those other breaks, whether it's health disparities, access to care disparities, homelessness, the broadening gap between the rich and the poor, we're just waiting for the next epidemic. Hopefully we can, we're seeing it happen now, right, with COVID. We're just looking to see, and those who are most vulnerable, those who live in the most vulnerable communities are those who are always most heavily impacted. We have to not just talk about where we've been and the trauma, the shared trauma that we have experienced and will continue to experience. We need to make sure that we're rolling in solutions that end this epidemic once and for all, so that we can be healthy and whole as a community again. Thank you.
Thank you, Larry. All right, we're going to open it up for questions from the attendees of this presentation, and I would like to thank for the invitation, you know, of this magnitude, the International Conference on Stigma, and for a heterosexual panel of men that are living positive being invited to lead a presentation. And I'd like to thank y'all once again. I can remember when I was in the military, I was fortunate enough to serve with the first person in the United States that went to prison for not passing the virus, but not disclosing the virus. Had a friend I was in the military with, and we was in Germany, and at the time they was testing everybody in the military, and they would as soon as your diagnosis came back, they were shipping you out. And he had sex with his wife, and they charged him, and they gave him 6 years, you know. And you would just think, you know, when we talk about decriminalization laws now, this person, his wife knew about his diagnosis, but he was sentenced for having sex with his own wife, you know, and that was a union. But under military code of justice, you know, things like that can happen. And so today, we're more fortunate. We have support systems. You know, at that point in time in 1985, there was no support system for him, but to incarcerate him. So I know the importance of having a support system and being a heterosexual man living with HIV. Mr. Kevin Marshall isn't here, but the first question I have is to Sean Mark. He was recently featured in Positive Wear magazine, and the question I have for you, Sean, is you've been featured in that magazine this month. How does that change the perspective of heterosexual men living with HIV? Because a lot of times we do not see heterosexual men in positive magazines. You know, we don't see them on the cover. When their story is told, they're in the back instead of the first or second story. So even within the HIV community, how would you think that could change? I see Mr. Bryant has his hand up too. Go ahead, Mr.
I was
Mark.
going to say, no, I just want to say, except for, you know, when they're on the cover.
Yeah. Okay.
Well, I mean, granted, Larry might have more to say about it, and Derek too. This would be my first in a magazine on this level scale. But for me, I think that, you know, growing up and going to these medical rooms and the hospitals and all that kind of stuff, I'd see, you know, articles with counterparts in it. You know, I wouldn't see anybody that I related to in those magazines. So I kind of just never paid attention to them. But what I could see is that, you know, if we have heterosexual men that are going to these clinics that are very uneasy and very uncomfortable and don't really look and see in the clinic anybody they can relate to. And why would you hold a conversation when you're in that kind of vicinity anyways? It kind of reminds me of, like, I saw a high school friend of mine going to get tested back in high school. I was so excited to see the person. I forgot like that I was in a clinic. And whereas I felt comfortable being there, I had totally forgotten that my friend had never been in this situation before. And it just so happened that I was able to be an encouragement to that person. But it was also baffling for me because I was like, oh, I'm so comfortable here. and another lesson in stigma I learned that day. I think just having the awareness there in the rooms is going to be a step in the right direction. But, maybe hopefully we'll get some more representation. And if not, it's there. But either way, it was a huge blessing to be a part of, and I'm very appreciative. But anybody else want to join in?
If not, do we have any, at this present time, do we have any questions from the attendees, Larry?
I see a lot of great comments. I do not see any questions yet. I see some former Campaign to End AIDS people in the audience. Hey guys, men and women. But no questions yet, Derek.
So, Derek, how do you feel about being featured in the magazine? I see one question that's popped up. We're gonna try to answer that before we go to you. It said, how do we educate youth and talk about this? The way we need to educate our youth is that the information that we give them have to be culture sensitive. I think the last data that I seen said like 70% of millennials say they feel uncomfortable around people living with HIV. And so the education has to be done that it isn't any fear, fear of touching, fear of being around. It's not like COVID. It's not just gonna come out of a person's mouth and you become infected. Not become infected, but you'll have an HIV diagnosis. You can't be breathed on to. You have to participate in the behavior. And one of the things that I do as a prevention specialist, I said safe sex is not uncondom. I created the word like uncondom. That means if you don't have knowledge of your partner HIV status, everybody's at risk. There's no color, there's no age, there's no subpopulation, and safe sex is not condom. Have knowledge of your partner HIV status. Today, you can get a rapid test in 20 minutes. You have take-home tests. So everyone has the responsibility to protect themselves. And I think that's how we begin with education. Go ahead, Larry.
No, in addition, I think all that was great, Derek. But what we also need to do is not just talk at children, talk at young people. What we need to have are more young people visible and vocal, sharing their perspectives, telling elected and leaders or, whoever, the gatekeepers in their communities, what are the education prevention tools that they need? The world that they live in is not the world we grew up in. And what we need to do is ascend more young people, HIV positive, HIV negative, to leadership roles where they are planning for the future, planning for the chance to kind of add additional strategies to how to reach people, how to talk to people, how to support people, and policies and campaigns, really, that help to enlighten those that aren't in these conferences, that aren't in these spaces. Because I've been doing this for, 20 years or more, and a lot of the same people are around. I mean, obviously there's a lot of people who have passed, but we need to back off, move, make space for young people and many of the people that we don't see at a lot of these tables. And I think D-Rec has something he was going to say.
I know that in my speaking gigs and different things that I've done, I was very fortunate that I'm also a DJ. So where I've been able to speak at the local college, and I also got brought back as a DJ to DJ different events at the college. And after that happened, whenever I would be seen around town, all these kids would come running up and hug me and shake my hand and go, "You're the DJ. I saw you speak in my class. We came and had, we danced at that party with you." So it's just about normalizing the interactions and getting the fear out of them. And they're very open once they've had both sides of it. I wasn't just there to teach them. They also saw me as a human. So you change that viewpoint. I wasn't just there spouting off a bunch of information. They had seen me in both capacities. And I think that's a big thing that, we're just missing. If you just walk in and you're just there to tell the story and then, all right, I've got to go, you've got to, I was able to come back to that same location and be something totally different. They saw me crawling on the ground, grabbing cables, putting all my DJ gear together, and then throwing a party. And they loved it. And that's what they remembered. And they also remembered that, hey, I saw you in my class. So that, has shown me that the impact comes from me having to be both people at the same time.
Okay, thank you, Derek. We have a question. I'm gonna let Clayton answer this. And do you think education will be enough to eradicate stigma?
Educating youth. Let me first say I was a single father to my daughter. I was solely involved in raising her and educating her. I do a lot of public speaking on HIV, public schools, um, on occasion at the juvenile justice center nearby, and some youth shelters. From my experience, lack of education is the biggest problem with educating the youth. Our kids are not taught almost anything about sex education, especially HIV. How are kids supposed to protect themselves from things they don't even know exist? As far as addressing the stigma with youth, it's been my experience that just normalizing it, just speaking with them one to one to a group, in person, breaks down most of the stigma that that they've picked up from hearing stuff on the street. I think we need to look at the way we're educating our children today and what we're not educating our children about today.
Thank you. Warren, go ahead, Larry.
I'd like to jump in if I could. I agree everything what Clayton was just saying. Definitely educating the children, having the perspective that I had of growing up, being positive and having the small sect of kids that would find out about me. My first bullies in life were because of my diagnosis. Now, that being said, though, is that the important thing to keep in mind is that stigma in itself is a fear of not knowing. So then if we can educate the kids, and there's a total possible way to educate children on HIV, and you don't need to talk about sex, even though it's a really big part of it. I live in a state where we can't really have those discussions in education places. You can't give out condoms without having a $500 fine per condom you hand out to a child. You can't have those conversations about sex, but you can still have conversations about HIV. We can still get that. And I agree with Clayton about normalizing our health and our wellness. We just had COVID come out. Everyone knows what COVID is now, and everyone knows the similarities between HIV or COVID, or at least they've heard about it. And that is the little worm that opens up the door to have the further conversations about what HIV is, about what stigma is. And just in the process of holding these conversations, we are defeating stigma, because in the process of holding these conversations, granted with the enlightened knowledge of what HIV is, then spreading that knowledge out is what in fact fights and combats stigma itself. I just wanted to say thank you.
Thank you.
I think we have to do more than just, I think education is a step. Having those conversations is a step. Stigma itself is like a cloud. If you try to grab it, if you try to hold it, if you try to eliminate it, you can't even hold it in your hand because it's made up of so many little droplets of little pieces that we can't just ignore the cloud. We can't do anything with the cloud until we identify those individual droplets. And the stigma we need to be focused on is not just the stigma of HIV. Many people, the people who are most impacted by the stigma around HIV are people who enter the life or living with HIV with stigma already. People who are homeless, people who are drug users. Hell, we just went through 2020. People who are Black, people who are of color, people who are immigrants, all of those things, the hate, racism, homophobia, sexism, the lack of urgency around providing healthcare to those who most need it, the lack of urgency around providing housing for those who need it. That's the kind of stigma that kills people, and that's the kind of stigma people live with until they die, or until they're shunned and then die alone under their beds because they can't walk around and just be human. So I think we have to go further than just identifying stigma as a challenge and identifying each individual droplet that makes up that larger cloud of stigma. Because you can't go to Congress, you can't go to your city council, you can't go to your governor, your mayor, your health department, and start to design strategies that address stigma alone and think that's going to succeed. We have to go steps further. When we address those concrete issues, those concrete fears, those concrete breaks in society, then we can start, stigma will go away because those disparities will no longer exist. So we have to put names on stigma. We can't just stop at stigma. We have to put a name to what we're targeting and then defeat it in that way.
Okay, I'm gonna invite one of our panelists, Mr. Calvin Marshall. Grateful that you were able to get on, and you wasn't able to speak earlier. Do you want to share now, Mr. Marshall? I see that he's on, but his video is off. Alberto Perez, do you feel you'd like to share now?
I don't know if you can hear me. Can you?
Yeah, we can hear
Can you
you.
hear? You can hear me for real?
Yes, we can hear you.
Oh, thank you. No, I've been sorry. I apologize. I really do, because I've been trying to get Wi-Fi where I am now, and I really apologize. I'm gonna take it like a few minutes, please. I just gonna tell you about my story, right? My name is Alberto Perez Bermudez. I grew up in Miami, Florida. I was having unprotected sex with a lot of different girls in Miami, so I never protect myself. And I went to one of the local clinics to do like a regular checkup. And they told me that I was HIV positive when I was 18 years old. So one of the things about stigma is that I want to get rid of, especially in my Hispanic community, is that they think that it's still a gay disease, it's still the drug addict disease. That's what they're thinking now. So I want to change that attitude to everyone. It doesn't matter if you're Black, white, Hispanic, it doesn't matter to me. But I just want to be able to make a difference, and hopefully all of us can come together as a heterosexual man and do what we need to do. And I do appreciate Howard University that it gives us a space to talk about that, and everybody in the panel too. And I'm looking forward to continue doing what I'm doing. I will not stop. I mean, we have to do it like everyday thing. You know, hopefully we don't forget that we gotta do what we need to do from now on. So what's the next thing that we need to do? Continue doing, hopefully, so we can be recognized everywhere. You know, I've done a lot of stuff locally and national. So now it's time for people to recognize, and hopefully in the future, we can work together with the gay community, whoever, it doesn't matter, whoever comes to us. So that's my focus on right now. And, you know, I'm excited about this. Is, you know, I'll be trying to get into it. And God, you know, thank God that He gave me the opportunity to speak to all of you. And I'm sorry, I apologize because, you know, I couldn't get on Wi-Fi, but at least, you know, you listen to me and everything that I need to say. And I'm here to just make it different like everybody else, you know, trying to do what I need to do. And hopefully we come together as once, you know, and work together as one too. So I will not give up until everybody get together, man. That's my main thing. And that's about it for now.
You know, in dealing with stigma, one of the things that I know that has to be addressed is what I call it the ABCs. A is the activating event of being diagnosed with HIV. What is your belief about being HIV positive, and what is the consequences behind your belief? You know, for some of us, when we become positive, we instead of turning to a support group, we may turn to drugs, we may turn to alcohol. You know, that may be our solution, because we don't want to deal. Not only do we not want to deal with being positive, but we don't want to deal with the stigma of being positive. The mental health issues that some people face with being positive. So all that component also has to be looked at, as Larry was saying, like stigma only encompass, you know, for some people it's fear, but somebody said earlier, now what happens when you start going to a mental health clinic? You know, that's another fear that's going to be associated with it. What happens when you go to drug treatment and they say you're a junkie, they say you're a crackhead, they say you're a meth head? That's another part of the stigma component that a person has to deal with. So we must have a comprehensive approach in order to deal with stigma, so we could become wholesome. I think that's the one of the things that we want to get out of this panel, is that even though we may face stigma, how do we become whole? How do we empower ourselves? You know, that's one of the reasons that we named the group Positive Entre Empowerment. You know, some people like, well, it's spelled wrong. You know, Entre Empowerment, it's an E missing. But you know, I learned in school the brain only remembers something unfamiliar. And I know that brought attention to people, you know. So we're saying that we're going to address stigma that heterosexual men deals with. I'm asking the host to put our email address in the box. If you know someone that is heterosexual, living with HIV, you know, they're welcome to join the Positive Entre Empowerment group, so we can continue this dialogue. And also we want everybody to fill out the evaluation at the end of this session. I'm gonna try to go back to Mr. Kevin Marshall, because he's a very important part of this Entre Empowerment group, because he happens to be in a serial concordant relationship, and some of the stigma that he has faced in the past, and maybe facing some of the same stigma now. I see him. I guess I just open up for the panel. We in our first. We have a few minutes left. How do you see this conference helping us in dealing with heterosexual men and the stigma that we face, and may be a barrier to us going to get treatment, being part of support services, community engagement on the local, national, or state level? Is this going to be a helpful beginning for all of us?
You're asking us?
Yeah, us, the panel. I'm just asking the panel a question.
Yes, I believe if we're ever going to make any progress, we need to be joining forces and working in tandem. I think the more exposure we get, the more attention we can draw to it, the better odds we have of normalizing it. And through that normalization, we can reduce the stigma. I think too many heterosexual men avoid testing and care simply to avoid dealing with the stigma that comes with a diagnosis. So I think partnership is the key word here.
I'm gonna jump in, follow up with Clayton. And Clayton, with all due respect, I'm gonna say we don't want to just normalize the conversation around HIV, right? We want to, it's a preventable, treatable disease. We want to end the epidemic. So normalizing is one of those first steps after educating and having those conversations. But what we need to do is to add solutions to what we need to have happen to make those outcomes real. And we need more straight men as a part of this conversation, whether their HIV status is irrelevant, being a supportive voice. We have to be, us on this screen, we have to be able to talk outside of these kinds of conferences, outside of these kinds of venues where it's kind of safe. We're kind of preaching, literally almost preaching to the choir, right? We need to have these conversations outside of here. That is the way, I mean, we just talked about, again, the normalizing, whether we're talking about young people, whether we're talking about communities in outreach, but we want to make sure that we're attaching outcomes that we can measure. We have to use our voice, we have to use our imagination, our creativity, our urgency to not just, again, not just have this same conversation a year from now, but we should be able to get together next year, all of us, on the screen and in the chat room, and talk about the leaps and bounds that we have grown since today. What have we done in the last 12 months? Next year, what have we done, or what will we do in the next 12 months? Tangible growth and change that will expand this conversation and take it outside of just the International Conference of Stigma, but put it in our churches, in our classrooms, in our living rooms, in our barbershops, on the basketball court, wherever. We have to not just celebrate that we're here, we have to move forward and provide stability and support for those that are still with us and those who come after us.
Well, you didn't leave much unsaid, Larry and Clayton. Awesome job, guys. Just to top off and throw onto there, I would say that, you know, the panel here, you know, we collectively, we got to work together, and respectfully, most of us here on the panel haven't been able to work with other heterosexuals in our field. So honestly, I think, you know, continued support for heterosexuals that work in the HIV community, representation for that would be awesome. You know, like as much as, you know, we can use our creativity and we can use all of our other gifts and skills that we bring to this, at the end of the day, you know, if we don't have funds to be able to do these things, we won't be able to, you know, do as much of that stuff either. So sorry. But sorry, yeah, I would say money and support also, you know, like how many grants are there written or are funded for people who are heterosexual? You know, we had 23% of new diagnosed people last year were heterosexual, with 16% of those being cisgender female and 7% being heterosexual men. You know, in order for us to continue doing this kind of stuff, we need funding and research. Thank you, guys.
Thank you. D-Rec?
I just hope we're able to stay together as a group. I think this has been great. This is the first time I was in a group like this, and I've been at it for 7 years. And it was great to just be able to have a group to sit down and chat with, especially getting prepared for this. It was really, really nice just having that perspective of everybody, and we all had, you know, pretty so similar stories, and just it's the first time that we've got to say that on such a big stage, and hopefully it resounds and that we stay together and we continue this, because I'm really, really excited and I really enjoyed it. Thanks, guys.
Thank you. I would like to again thank our panelists for such a wonderful presentation. It took a lot of work to put it together. It took a lot of trust. I think Kevin Marshall is the only one that I have personally met. You know, I happened to meet him at the Positive Living Conference after Zooming with him for 18 months, you know, dealing with a support group. But like, you know, this space here seems to be the space where everybody meets at now on Zoom. And maybe like someone put it in the box, they say Larry is getting pretty elderly in the work he's done over the years, and we need younger people. But you know, it's a lot of avenues out there. You know, it's TikTok out there. You know, I'm stuck on Facebook. I'm not with Twitter. I'm not with
Hey, you got a DJ.
Yeah, we got a DJ. So maybe it could be DJ World now. But I'm grateful that we was able to put this presentation on. Thank you, Ms. Houston. Thank you, Ms. Jackson. And most of all, thank Howard University.
And thank you to all the participants. And, you know, this is, and we can't see you, but we can see you in the chat. We know there's over 100 of you out there. So amazing to kind of feel your presence as well.
We will conquer stigma, maybe not in my lifetime, maybe in my lifetime, but we're willing to do the work to get it done. Like Larry said, in the churches, in the homes, in the community, on the playground, at the rec centers, in the places that we have to go and do prevention, you know, in the high impact areas. Because the main thing is that if we can take away the stigma, if we can get a person in treatment, if we can get their viral load suppressed, and we're working towards ending the HIV epidemic, and reducing stigma is part of that, you know. And I'm grateful for the work that each one of us do in the field, whether it's through a virtual platform, whether it's through blogging, whether it's through mental health, or maybe you may be just like myself. I'm a foot soldier, you know. I go out and do prevention in six counties in Northwest Florida. So with all the funding that goes with ending the HIV epidemic and ending stigma, don't forget about us here in the rural South, because we really need your help. And we'd like to thank you all for attending this presentation. It's been a great and wonderful pleasure to do this with all y'all that's on our panel. Thank you and have a good day.